I'm the Senior Medical Director for the Clinical Integration Network, UH Quality Care Network. We are 5,600 employed and independent licensed providers as a network here in Northeast Ohio. So we cover 350,000 patients under population health service agreement with different organizations, with Medicare, with the commercial payers, with our own employees, and we have some direct-to-employer contracts. So we manage about 350,000 people under those type of arrangements. When I encounter a patient in my practice that has been to an outside facility not within network, where I don't have access to their inpatient record or lab results or radiology results, I usually will go into the HIE to see if I can find those results, either from the Cleveland Clinic or Metro or Lake Health System or wherever they may have gone. So that's how I primarily use it in the practice setting. But what I'm more excited about actually is how RNs use it in our population health services, because they do a lot of transition of care calls and a lot of care management, and they will actually know that a patient was discharged from one of the competing health systems here in the city, and they'll actually go on the HIE to find out what happened to the patient, which really helps with their transition of care. We do have both registered nurses and medical assistants who are trained as navigators in our population health, who do transition of care calls. So if they're in the hospital and they get discharged, or if they're in the emergency room and they get discharged, once we know that they were there, we will then call them and touch base with them and make sure that they're getting better as expected, and trying to prevent readmissions and help them coordinate getting their specialty appointments made or their follow-up testing. They can get access to the discharge summaries through CliniSync, which helps them know what the patient should be doing in follow-up, especially when it's a system outside of our own. Because we have that access here locally, we can see those things. It's as part of our system, but when the patient ends up in a competing ER or another health system and then gets admitted, CliniSync is very helpful in looking at that documentation. We don't reorder tests that have already been ordered. For instance, if we can get the information about the CAT scan or the MRI, we don't necessarily need to order another CAT scan or MRI, so it saves certainly a total cost of care by knowing what happened. And patients, unfortunately, they usually don't have the level of detail needed to be able to direct care, so having the actual report is very important. And the more knowledge we have about the total picture, the less likely we are to order inappropriate testing and submit patients to uncomfortable testing. And so it saves them too. It saves their money, and it also may prevent an unnecessary procedure or test that's uncomfortable for them as well. I hear from my colleagues that they like the fact that they have a single sign-on into the CliniSync platform, so that the patient is in context and they can go right in and see what they need to see, as opposed to having to remember another username and password to get in. So having the single sign-on through our TouchWorks platform here at UH has been amazing.